What is the best diet for PCOS? Experts weigh in on what to eat and what not to eat if you have polycystic ovary syndrome. When you think of polycystic ovary syndrome, PCOS, you probably think of a gynecologic issue. It has the word ovary right in the title, after all, but PCOS is actually an endocrine disorder, which causes it to wreak havoc on the body's hormones. A lot of organs are victims to this syndrome. The ovaries are just one, said Lana Boter, MD, a gynecologist at NYU Langone Health. It affects the entire endocrine system, from the pancreas, which produces insulin, to the thyroid to the pituitary gland. Because diet plays a role in maintaining the body's endocrine system, people with PCOS may find relief and healing from their PCOS symptoms by paying closer attention to what they eat. Here's why. How PCOS is diagnosed. For starters, it helps to understand what exactly PCOS is. Polycystic ovary syndrome is often misunderstood because there is no one test that gives the diagnosis, said Alice Chang, MD, an endocrinologist at the Mayo Clinic. While difficult to diagnose, PCOS is common. The issue affects 1 in 10 women of childbearing age in the United States, according to the Office on Women's Health (OWH). People may be diagnosed with PCOS based on ultrasound findings of cysts on the ovaries. Hormone blood tests may also be used since people with PCOS have elevated levels of androgens, which are male hormones, per the OWH. Androgens can cause noticeable physical symptoms. Some women have hair growth on the face or body or significant acne. Others may have primarily irregular menstrual periods that are typically fewer than 9 per year, or some women have more frequent bleeding because they are not ovulating regularly, which can lead to infertility, said Dr. Chang. It can also cause higher blood pressure, abnormal cholesterol levels, and weight gain. What's the link between insulin and PCOS? According to Medline Plus, in addition to high levels of male hormones, people with PCOS often also have high levels of the hormone insulin. Insulin allows this glucose to enter all the cells of your body and be used as energy. Their cells don't respond normally to the hormone, a problem called insulin resistance, so insulin builds up in their blood. We eat foods that require insulin output from the pancreas, said Dr. Boter. Then, the body doesn't respond that well to insulin, so it has to produce much more to drop sugar levels and the pancreas works overtime. Therefore, people with PCOS have a higher risk of developing diabetes. Because of the insulin resistance, women with PCOS are more likely to have prediabetes or impaired glucose tolerance, said Dr. Chang. If your pancreas cannot make enough insulin to control blood glucose, you can develop diabetes and the medical consequences of high glucose to the body. But insulin levels can be lowered with diet and exercise, said Dr. Chang. Diets with fewer simple carbs will be less likely to stimulate the higher insulin levels that could be driving or increasing androgen production. How diet affects PCOS. Following a lower carb diet may help, and many women with PCOS may not have realized how many carbs they were eating to begin with, said Dr. Chang. Most patients I refer to a dietitian are surprised by how much more protein and vegetables they should eat compared to carbs. Dr. Chang recommended starting by making sure the majority of your plate is full of veggies and protein and staying away from simple carbs, like white flour and added sugar, that increase insulin secretion. By decreasing carbs, you're no longer feeding the beast of insulin, said Dr. Boter. Dr. Boter suggested that patients with PCOS eat between 40 and 50 grams of carbohydrates each day. But that doesn't mean your diet should be all protein all the time. People think a low-carb diet is all steak and eggs, but making sure you get enough fiber and vitamins, especially from veggies like spinach, broccoli, mushrooms, and cauliflower, is extremely important, said Dr. Boter. Research published in Frontiers in Endocrinology in 2021 found that people with PCOS who followed low-carbohydrate diets were superior in optimizing reproductive outcomes and ameliorating symptoms. 10 keto-friendly vegetables you should eat more of. Asparagus. Net carbs, 2 grams. A serving of asparagus, 5 spears, contains 20 calories and 4 grams of total carbs, or 2 grams of net carbs. The veggie is a good source of folic acid, D, fiber, and vitamins A, C and E. Additionally, it could help prevent UTIs and depression. Bell peppers. Net carbs, 4 grams. Bell peppers are another low-calorie source of vitamins. A medium bell pepper has 25 calories, 4 grams of net carbs, and 190% of your daily vitamin C requirement. Broccoli. Net carbs, 3 grams. A serving of broccoli, 3 ounces raw, has 30 calories and 3 grams of net carbs. Like other cruciferous vegetables, broccoli is considered a great source of nutrients. It contains vitamins A and C, B vitamins, magnesium, and potassium. Broccoli therefore can help you protect your heart, brain, and bone health, and could prevent inflammation and cancer. Brussels sprouts. Net carbs, 3 grams. A cousin to broccoli, Brussels sprouts are another excellent source of nutrients. One serving, 1 cup or about 4 sprouts, has 40 calories, 3 grams net carbs, 2 grams protein, 3 grams fiber, and more than the amount of vitamin C and K you need in a day. As a bonus, they have anti-cancer, heart health, blood sugar regulating, and anti-inflammatory benefits. Cauliflower. Net carbs, 3 grams. Another member of the cruciferous family, cauliflower is a versatile low-carb vegetable that can be used as a stand-in for rice, mashed potatoes, and even pizza crust and baked goods. One serving, 3 ounces, of cauliflower has 25 calories, 3 grams of net carbs, 100% of the vitamin C you need in a day, and a good amount of folic acid. Like its cousins, broccoli and Brussels sprouts, cauliflower can also protect your heart health and help fight cancer. Kale. Net carbs, 1 gram. A serving of this green, leafy vegetable, 3 cups fresh kale, provides 20 calories and 1 gram of net carbs. Like most leafy greens, kale is a good source of vitamins A and C, potassium, vitamin K, calcium, and magnesium. It can therefore protect your bone and heart health, reduce inflammation, protect your eye health, and help prevent cancer. The green is also packed with beneficial antioxidants that may help protect against chronic diseases associated with aging. Mushrooms. Net carbs, 2 grams. Mushrooms are another flavorful and nutritious low-carb vegetable. One serving, 5 medium mushrooms, has 20 calories, 2 grams of net carbs, and 3 grams of protein. Plus, the fungi are rich in B vitamins, copper, vitamin D, and selenium. According to a 2014 Integrative Medicine, a clinician's journal article, the agaricus, lingua, caterpillar, turkey tail, and maitake mushrooms could bolster immunity and may have anti-cancer benefits. Spinach. Net carbs, 4 grams. Spinach is another good source of several nutrients. A serving of spinach, 1.5 cups of fresh leaves, has 40 calories, 4 grams of net carbs, and 2 grams of protein. With 6 grams of fiber per serving, spinach helps you feel fuller for longer and is also an excellent source of vitamins A and C, iron, folic acid, and magnesium. As such, spinach could help lower your risk for heart disease, cancer, diabetes, eye conditions, and cognitive degeneration. Tomatoes. Net carbs, 4 grams. Tomatoes are a healthy addition to any eating plan because they're a rich source of lycopene, a phytonutrient that has potent heart health and anti-cancer properties. A medium tomato has just 20 calories, 4 grams of net carbs, and contains vitamins A and C. It is also a good source of potassium. However, the choice of fats you're eating is important if you choose to follow a keto diet for PCOS. Some ketogenic diets will not specifically limit bad fats or specify healthier, plant-based unsaturated fats, said Dr. Chang. Because insulin resistance is associated with abnormal cholesterol levels, in particular, higher than normal triglyceride levels, this might worsen already abnormal cholesterol levels. Thanks for watching. Check out our other videos for important health tips.